Good day, everyone. Sonny Gurney of 4T Brokerage. As you guys know, there are a lot of changes coming with CMS regulations for 2024, and they're going to affect you coming up on October 1st. So what I'm going to do today is I'm going to cover, I think, the top 5 that I believe are going to be most impactful for your business. And understand that this video is designed to help you understand some of the changes and how they're going to affect your business. But it's not going to be covering every CMS guideline. It's just a summary of the ones that we think are most important. So it's really important to understand that you have to do your own research to ensure that you're staying compliant at all times with CMS. Now, with that being said, let's go ahead and get started with the 5 most impactful CMS changes that are going to affect your business going forward into 2024. The first one is in dealing with TPMOs. And what is a TPMO? It stands for Third Party Marketing Organization. Now, understand that you as an agent is a TPMO. Me as an FMO is a TPMO. An agency owner is a TPMO. Carriers at TPMO. Just understand that everyone who's dealing with Medicare and sales at some level is going to be a TPMO. So understand that now third-party marketing organizations only need to record sales, marketing, and enrollment calls. Now, understand that we get a lot of agents that call in asking us, well, what does it mean? What's a marketing call? What's a sales call? What's an enrollment call? And our answer to that and what we do internally is we just record every phone call and attach it to the client's profile. It's the best practice. It keeps you safe. And guys, these carriers are going out and they're now doing audits. We've had a number of carriers request the audio recording of sales enrollments. So we use a company called Agency Block for our CRM. And for our phone, we use a company called Intulse. We actually posted a video earlier this year on the benefits of using both of them, because what happens is we put all of our leads into Agency Block, we put all of our customers in Agency Block, and then anytime we're using the Intulse phone system to make an outbound phone call or we get an inbound phone call and that phone number is attached to a profile in Agency Block, it's going to record the call, but then it's also going to automatically store that recorded phone call under the customer's profile. So it's really important that you are compliant on phone recording. Now, if you're doing a Zoom presentation, CMS guidelines are saying that you only have to record the audio portion of it. Now, I don't know. I've used Zoom numerous times. I know how to record a Zoom meeting from start to finish with the recording and the audio. I just don't know how you would separate it out. Best thing to do, record it and make sure you store it in a CRM for safe measures in case you get audited down the road. Now, another thing is with disclaimers. TPMOs now have to use a disclaimer that includes reference to the state health insurance program, otherwise known as SHIPS. And it also requires TPMOs to include the number of carrier representatives and plans that are offered in a service area. Now, guys, if you're working in one county, it's easy to go through and say, I represent X amount of carriers and X amount of plans. However, many of you are in the state of Michigan and you're in multiple counties that you represent, and different counties have different carriers and different plans. And what about the agent who's contracted in 2 states, 5 states, 40 states? It's almost impossible to go through and create a disclaimer talking about carriers that you represent and plans that you offer in a specific service area. So what we're recommending is that you make a generic disclaimer talking about you represent X amount of carriers and approximately X amount of plans over a 85 county area or over a 3, 5, 10 state area, just to kind of give some sort of generic disclaimer. But like I said, it's almost impossible to give this very specific one. Another one is talking about contacting beneficiaries. We in our office, we have helped tons of agents do BRCs or business reply cards, which is a direct mail piece. Now, understand that one of the good changes is that BRC is now permission to contact that's valid for 12 months. It used to be a lot less in the past, But now we know if we get a direct mail piece back, and we've got 12 months to contact that client. But one of the downsides is what agents would do is when they got that business reply card, they would start calling the customers. And then those that didn't answer the phone, sometimes they'd send out a letter. But then what agents would do is they would take that physical postcard and they would go out to the customer's home and they would door knock and say, hey, you sent this card back in the mail. I'm just here to help you out. Problem with that is CMS guidelines states agents and brokers may not go to an individual's home without a previously scheduled appointment for that specific date and time. So understand that door knocking is no longer allowed. Now, there's a caveat because if you're selling just Medicare supplements, there's no CMS guidelines for door knocks. So if you have questions about that, make sure you reach out to me because there's a right way and a wrong way of doing that. Also, plans must now provide an annual opt-out for clients for planned business through telephonic phone calls. So just make sure you guys follow through, look at how you're marketing these customers, and make sure you're CMS compliant. Next one is scope of appointments. Now, many of you understand what a scope of appointment is. In the past, we used to have to do it 48 hours in advance, and we made it work. There's ways of doing it that are easy to do, and then there's ways that are a little bit tricky. But anyway, scope of appointments are now valid for 12 months, which is clearly defined in CMS regulations. And as far as the 48-hour prior to an appointment, there are some exceptions to the rule. So you can get a scope appointment signed at the appointment if it's less than 4 days of someone's valid enrollment period, or if it's an individual who initiated an in-person walk-in meeting. So if you want to help understanding this rule, let me know. And there are workarounds on how to get the scope appointment done compliantly. Just feel free to reach out to me. Last one is we're going to talk about events. So for those of you who are doing like educational dinner seminars, in the past, you could hold a seminar and then at a later date, you could have a sales meeting, or later time, I think what it was, you could have a sales meeting with that person. So what some agents were doing is they were doing their presentation, and then 5 minutes later, they were meeting in a different area of the building and doing a sales presentation and enrolling them. Now, what CMS is saying is agents and brokers may not hold a sales event within 12 hours of an educational event in the same location. So if you want to do one 5 minutes later, you actually have to use a different physical location. So just understand there are secret shoppers out there and you don't want to get caught breaking CMS regulations. Next, when it comes to SOAs, is that agents and brokers may not distribute or collect scope of appointments at educational events. So this is something else that I know many of agents were doing. They were holding their educational events, talking about the value that they bring, and then they were walking around the room and collecting scope of appointments for future meetings. That can't be done. And also what agents were doing is they were scheduling sales events right after the educational event. And then CMS now came out and said agents and brokers may not set up future marketing, which is sales, appointments at educational events. So what we've been working with our agents that are doing dinner seminars is using a form that basically is a permission to contact form. So you've got to create the value, and in your presentation, you just have to be more pointed in your wording to let them know that they want to schedule an appointment by filling out that permission to contact form. There is a difference between communication and marketing materials. This one's a little bit more confusing, and there's a lot of questions going on, and carriers are talking about this. The first one says agents and brokers may not use superlatives without supporting data or documentation referenced. So one of those superlatives could be like, I'm a Medicare expert, and you're not supposed to use that term unless you can support it with data. How do you support the fact that you're a Medicare expert? I have no idea. So you want to make sure that you're not using words that you can't support, or you can't document. Another thing that they said is that agents and brokers may not use Medicare, the CMS logo, or other products or information in a misleading manner. And so that's coming down to using the word Medicare in their website. And there's a ton of agents that have Medicare in the URL, in their company name, and CMS has said that you can't use it in a misleading manner. Well, how do you define a misleading manner? We have Sunnyside Medicare. Is that misleading? Do people think they're actually calling in to Medicare if they call our phone number? I don't think so. But I will tell you that one of our carriers is having a webinar coming up in the next week or so where they're interpreting that CMS is saying you cannot use Medicare in the name of your company. Interested to see how this turns out, but just be careful and have a backup plan. Have another company name that you can use. So if they pull the trigger and they say that you can't use the word Medicare, you're rerouting it. So in our case, I went ahead and bought a company called Sunnyside Health. So if they come out and say we can't use Sunnyside Medicare, we're going to have everything routed to Sunnyside Health so that we stay compliant. Also, agents and brokers may not use the Medicare ID card image unless it's authorized by CMS. And all I have to say is good luck getting that permission, because I think they're going to look at that as misleading in any usage. So if you're using it on any mailers you send out, on any images on social media, if you're using it on your website, you're going to need to take that down pretty quickly to be compliant. All right. So lastly, these changes are going to apply to you and your downlines, including plans for Medicare Advantage, prescription drug plans, and just MA only. For more information, be sure to subscribe and follow 4T Brokerage on YouTube and our social media outlets for more updates and how your business can remain compliant in 2024. If you have any questions, feel free to reach out to me. And lastly, I want you to understand that compliance falls on your lap. We're going to do the best job that we can. Carriers are going to do the best job that they can of helping you stay compliant. But ultimately, if you get a complaint or a violation, it's going to be on you, not the carrier, not the FMO, not your colleagues. So make sure you get a copy of the regulations. You can email us at agentsupport@4tbrokerage.com and get a copy of 2024 CMS regulations. Thanks a lot, guys, and have a great day.